based care on an accelerated basis.
And India is also moving towards this insurance base. I sometimes wonder whether they're moving backwards into a US model, or is their model better off? And what do you say to the Indians and those entrepreneurs in India? Healthcare is being revamped there. What
I
way
think
do they go?
just like in mobile, India has an opportunity to leapfrog, and I think it really should be towards this kind of a preemption system, like what Caroline was saying, right? And sort of building that to keep populations healthy, and then an insurance system which is for catastrophic care, and not let the same, not fall into the same trap that happened here. If you look at the history of how insurance developed in the U.S.
There's another question here from Hitesh Rastogi, another entrepreneur starting his own company. Diabetes has been one of the most successful application areas for digital health. Could you share your perspectives of problems still unsolved in the cardio-metabolic space? Do you see a future where we would have digitally native virtual healthcare providers focusing primarily on chronic conditions like diabetes end to end?
Caroline, that's a tough question. That's a good one for you.
I say, I think this sounds a little bit like Teladoc and Livongo, but so yes, we do see a future where that will happen. No, I think I think again, like to me, one of the things, and Color focuses a lot on this, and this is particularly because of the acute public health situation that we're in here. To me, is really also around equity in these models and around access across very diverse populations. And I think that again, like, is something that it's so interesting to me seeing, we sit in these conversations with public health leaders all over the country every day now. And we'll show them our product. We'll walk through exactly how things work. And the questions are always around, well, is the software component of this, is the fact that they need to use a mobile phone actually a barrier rather than an enabler? And like, we just time and time again, especially in the US, we see it 100% as an enabler, where if you have to call somebody and wait for an hour on a phone to get an appointment, it completely changes how access happens. And I think that's one of the things as it relates to, exactly this question, like digitally native kind of virtual healthcare providers. I think this is the key enabler of healthcare utilization from an equity perspective, not the barrier. And I think that that's also something that's going to change and shift in this model, where public health, leaders and sort of healthcare leaders are starting to see that you actually can transform uptake and utilization through technology. And particularly in these areas where ongoing engagement, ongoing sort of connection with people is critical to the care management broadly. That's what's going to be really at the core of it.
Yeah, and then by the way, the question is spot on. So like at Livongo, we used to talk a lot about what is going to be the second center of gravity if diabetes was the one where we took the diabetic persona and then we're solving for their comorbidities, hypertension, weight loss, and whatnot. Cardiometabolic is a standalone category, and there hasn't been enough work done in terms of redefining that experience that's like really scales. So it is an open area that has good opportunity.
Again, two areas: diabetes, hypertension, cardiometabolic, all areas where India has a lot of issues with its population that we need to work on. Again, going back last 100 years, we've been all scaling up. We've got hospital systems where we had family doctors. We have banks where we used to have other options. And then also we have schools, which again, mass produces, education is mass. And now we're going back from, treating the masses to treating back to individuals. These systems are breaking down, right? They're not fulfilling the needs of society today. And you are talking about this whole paradigm shift, right? And all it needs is a trigger, a powerful trigger. Where do you see the trigger is? Is COVID the trigger for healthcare to make the shift, or do we need a more powerful trigger to see this shift back to the old way of things, but better with technology?
Yeah, I mean, I do believe this goes back to my point of COVID being akin to the iPhone moment. That's really what I mean. I mean, I think what's happened as we have organized humans digitally, content, community, commerce. We're going from this era of mass production to mass personalization, and that's the whole thesis behind the first book around unscaling. And I think COVID does exactly that. Because what is color doing? You now have a way to take an entire population and at an individual level, make sure you can keep them healthy. That's mass personalization, right? At an individual level, you can see if they have propensity for certain kinds of diseases because of the genomic construct, or see if their social determinants of health might lead them a certain way, or see if they're likely to get COVID, if they have gotten COVID, or they might be spreading to, right? So I think I'm just sort of saying different use cases so that you can literally take those rails and keep people healthy at a single person level. I think that is the paradigm shift that technology enables over the next decade. You know, to bend the cost curve. I mean, like we need to do this if it's going to be affordable.
Care is coming back to the home as opposed to you going to the hospital. You're going to see more and more of it moving the other way around. I know we are running out of time, and I know Hemant has a hard stop at 8:30, getting into another meeting. So here's the last question for two of you. And this is a very futuristic question. What are the biggest problem in healthcare, in your opinion? And where do you think we will be in 10 years from now?
Caroline, me?
All you.
I think the biggest problem is this misalignment. If you create the economic alignment and decisions across the board, there's no silver bullet in healthcare. Decisions across the board get made with that rational economic behavior. Then the consumers are going to demand that I want the same experience when I go purchase a book at Amazon in how I procure healthcare, or I want the same understanding of my body that Jiffy Lube has when I go take my car for an inspection and they do a 28,000 point inspection or whatever that is. When I get my physical, they kind of touch me in 4 spots and touch my blood pressure and say, you're okay. This is a much more complicated vehicle, right? And so I think that to me is ultimately what needs to happen so that the consumer gets empowered to make rational decisions. And once that happens, like every other industry, I think this model will tip.
Well, Carolyn, do you want to add anything to that?
Completely agree.
Yeah.
It was all exposed this year in particular. And yeah, I agree that I think that that's going to be the biggest thing, and that a lot of companies are driving at trying to fix. And I think a lot of that innovation is going to come from the private sector, candidly. Like, we can't wait for governments to act here. It's going to have to come from I think, a lot of the work that folks like Hemant and his companies are doing.
Bringing the patient back to the center of the whole equation is what we are hearing. And so there you go, startups that are creating solutions. Maybe you know who your target audience is and who you should be catering to. But thank you again, Hemant, for this really very informative session. Thank you, Carolyn. You did an outstanding job with the conversation and also bringing to life your own company, Color, which is doing some interesting work and has pivoted with COVID and creating these testing sites all over the country. So great to hear from you. Great to hear from you, Hemant. Thank you very much. And thank you for TIE Global and TIE Global Health for this session. We look forward to more sessions in the future. We have a global summit coming up December 8th, 9th, 10th. That's going to be virtual in India. Us looking for investors and startups to present their innovative solutions and investors to give feedback to these startups. So if this is of interest to you, write to TIE Global Health and they'll put you in touch with the right people. Thanks again, Hemant. Thank Caroline, and thank you, audience.
Thank you. Bye-bye.
Thank you.
Bye-bye.